I see a lot of people with painful hip arthritis. I'm a hip surgeon after all, that's my job. A lot of my patients are women and they often present to me in their 50s. This is a time when the menopause kicks in and many women experience a sudden increase in their arthritic symptoms around this time. As if the menopause wasn't difficult enough with all the other symptoms you get from it, there's definite evidence to suggest that arthritis can be made worse during the menopause. What I find particularly interesting is that there's good evidence emerging now that if you eat a good diet around the time of the menopause, this can directly affect the symptoms that you feel from your hip arthritis. I'm not sure it will delay the need for surgery if your hip deteriorates to that extent, but certainly can help you manage your pain and stiffness and keep you going during this difficult time. Also, good diet can certainly help you get a better outcome from surgery if you lose weight and maintain a good balance of nutrients and minerals. I've recently had a long discussion with Sophie Lett. She's a nutritionist who practices not far from where I live. I wanted to ask her about how anti-inflammatory diets can help people with arthritis, particularly women going through the menopause. Have a listen to what Sophie has to say. I hope you find it as interesting as I did.
Yeah, so I think what's interesting is a difficult time going through the perimenopause and into menopause. And I guess the key thing here is inflammation. So what tends to happen as we go through this phase is that it's the sort of drop in estrogen. So when we're perimenopausal, you get the sort of swings of estrogen, so you get the highs and the lows.
Yeah.
And when you get the drops in estrogen, this is often where people experience things like joint pain, and obviously because we have estrogen receptors all over the body, including in our joints, that's why we feel it. So there's a lot of it is to do with inflammation, really, and that's how I approach it, mainly from my side. So obviously nutrition is something that I would look at with people. Also, just to say, it's also thinking about some of the lifestyle factors as well, like sleep and stress, that play quite a big role in inflammation. So, for example, and also, for example, with perimenopausal insomnia that people suffer with quite a bit, it can make you more sort of sensitive to pain. So it's also about working on some of those as well. And another area that's interesting is that we tend to become a bit more resistant to insulin as we go into menopause. And insulin regulates our blood sugar levels. So as we become more insulin resistant, we can end up having higher blood sugar levels. And this is also a cause of inflammation in the body. So there's various things to sort of factor or think about and factor in. And obviously with each person, it depends where they are and what their lifestyle's like and what their diet's like as well. Weight can be an issue, obviously, to start with, and it becomes harder, I think, as we get older to manage that. It's not just the lows, it's not just the physical weight, it's actually the inflammation that is caused from our fat cells that is actually impacting joints. So things that you know, obviously. So really, I guess the first thing is to think about an anti-inflammatory diet and how do we implement that. The diet that comes out in most studies is the Mediterranean diet, which is classically anti-inflammatory. And what that really means is a lot more veg, a lot more vegetables, and thinking actually a little bit more about fat. So fat has quite an inflammatory role depending on what type of fat we eat. So we need to sort of shift the types of fats we're eating. So not being scared of fats, but moving more towards healthier fats. So omega-3 in particular, which we get from oily fish mainly, is highly anti-inflammatory, and we don't really get enough of it in our diets. We need to be eating sort of 2 to 3 times a week, really, to get a good dose of omega-3. And then oils such as olive oil, really good anti-inflammatory oils. Some of the fats that are found in nuts and seeds are also really healthy. And so including those are important, whilst also trying to sort of balance out a bit more saturated fats from things like red meat, which can be quite inflammatory. A lot of the sort of margarines and processed fats that you find in things like cakes and biscuits that are not homemade are also pretty inflammatory. So we want to sort of think about changing those healthy fats And then with protein, I guess it's making sure we've got good sources of lean protein in the diet. The Mediterranean diet tends to favor more fish than anything, and lots of legumes and beans, etc. And then another really key thing, I think, when we think about anti-inflammatory diets is thinking about color. So getting a real range of vegetables in the diet, and through that you get a lot of different fibers as well. And I guess also the other thing with anti-inflammatory diets is trying to get as much as possible lots of sort of herbs and spices, because they have lots of different chemical properties in them that help to fight inflammation or to be anti-inflammatory. So those are really important. Gut health also, obviously a big topic. I mean, I think people know about gut health a little bit more than they used to, but certainly trying to encourage a sort of healthy microbiome, which is what they call it, because our gut microbes actually influence our immune system. So if you have a good, healthy microbiome, then it tends to support inflammation and our immune response. So really, really important to think about gut health. And I mean, obviously people think about probiotics, but you can get a lot of support from food. So thinking about sort of incorporating things like just yogurt, which has live cultures in it, is really, really good. You can eat things like sauerkraut. You can actually get really good ones now in the supermarkets, even Sainsbury's. So you need to look at the ones really in the fridge, because they have the live bacteria in those. You can get
these are fermented foods, are they?
Yes, fermented foods. Yeah. Fermented
what about
foods.
things like kimchi? Because I went to South Korea
kimchi.
years ago, and the kimchi is wonderful.
Yeah, absolutely. So having sort of variety of those, so kimchi, kefir. Kefir is a kind of yogurty drink, which is also, again, you can get a lot of these in the supermarket. You can make them as well, bit more of an effort. You can also get kombucha, which is a drink. It's like a fermented drink, which is quite nice. And the thing to remember about the gut microbiome, which is nice in terms of the anti-inflammatory diet as well, is that all the bacteria feed off different fibers and different chemicals as well. So the more varied your diet is, the more vegetable fibers, the more colors you have in your diet, that actually helps to promote the growth of those healthy bacteria. So by it's sort of increasing your vegetable intake and diversity can be very, very helpful for that as well. So certainly it's one of the things I focus on a lot with clients is starting to sort of increase the sort of anti-inflammatory side of their diet and try to sort of crowd out the more inflammatory foods. So that's something that's pretty important. The other thing that I work on quite a lot with, I do with most of my perimenopausal and menopausal clients is working on their sort of blood sugar control, because as I mentioned before, insulin, our insulin response to insulin tends to start to go down. We've become less sensitive to it. So we need to try and regulate our blood sugar levels much better through our food. And so it again depends very much where someone is in their diet, but a lot of that is about looking at what they eat in terms of, are they having just a high carb meal with very little protein or very little fat in it. So anything that's high carb or refined carb, and by that I mean things like pasta and white flour products. So for example, for breakfast, if someone just has toast and jam, they're going to spike their blood sugars, and it can actually really affect their inflammatory response if they do that. So they want to be thinking about having meals that have a good balance of protein, healthy fat, and carbohydrates, so that they're not causing this sort of spike effect in their blood sugar. So we do quite a lot of work around that, which is really, really helpful. And that also can be very supportive for weight as well. So something that is really important to kind of address early on, I find. One of the trickier ones is probably alcohol. So trying to get people to change their relationship a little bit with alcohol. So alcohol, one of the biggest issues with it is actually how much it affects people's sleep. And if you're not sleeping well, it does tend to increase that sort of sensitivity to pain, and a lot of the symptoms that go with perimenopause are exacerbated by sort of poor sleep. So it's really really important to think about alcohol in that respect. It also depletes our nutrients, and it obviously affects our liver and how we detox other things through that. So it's quite an important one to try and sort of reduce or think about our relationship with it and how often we are having alcohol. That can be very, very important. So those are some of the key things that I look at first.
Yeah, really interesting, because the alcohol particularly, because there is, some people, some work suggests that particularly red wine in moderate quantities is actually beneficial because it contains lots of antioxidants.
Yeah.
Because of course all these things are a balance, aren't they, between the negative effects of alcohol, particularly drinking beyond a certain time in the evening. I know that if I have red wine into the evening, then I sleep very, very badly. So I avoid it now. And one of those things, as one gets older, you become much less tolerant, I think, of some of these things.
Absolutely. Yeah, and
so being aware of that is the key, isn't it, really? And how, when you start these diets, Sophie, and you encourage people to change how they eat, what's the sort of time frame that you see before they start to have noticeable effects?
It depends a little bit where someone starts. So I tend to work with people for 12 weeks initially, because that gives us time to make changes. And I think that the way I work also is I don't give them a diet as such. So we work very much together on looking at how they eat, what they eat at the moment, and then we try and make some changes, and we sort of prioritize. And I think, realistically, it's hard to make huge changes for most people, even in 12 weeks. But most people I see will really start to notice differences maybe after 4 or 5 weeks, that they'll start to notice. It depends again on the individual and whether they actually are able to make the changes as well. If they feel sometimes, life gets in the way and it doesn't happen so easily for other people. But usually sort of by the end of 12 weeks, people will have noticed, a difference and a shift in how they feel.
It's interesting that 3-month period, it sort of resonates with what we see in orthopedic surgery as well, that the recovery from surgery tends to go in 6-week periods. So the first 6 weeks, the body is repairing itself, both physically and psychologically. And by about 3 months, the body is sort of adapted and healing has taken place, and the inflammatory phase from surgery is receding rapidly. So it sort of chimes with what we see in the surgical world as well, that it does take that sort of time for change to work its way through. And one of the other things that I wanted to address is a friend of ours who, as she's gone through the menopause, has become very intolerant of nightshade type foods, which I think, like tomatoes, aubergines, which of course are part of a Mediterranean diet. So what's the thinking behind that? Why would someone become intolerant to those sorts of foodstuffs, which seem to be so healthy in all other respects?
Yeah, I mean, it's hard to know exactly why that people do become more sensitive, but there's various thinkings. Again, like with estrogen being sort of anti-inflammatory, as we lose estrogen, our immune system is kind of more likely to react to things. So there are certain foods that you could have eaten before that you can't, or you just find that really affect you. And also, I think what's important to be aware of is that our digestive system sort of starts to slow as we age. And again, estrogen affects our gut motility. So that's how fast things transit through the gut. And it also, our hydrochloric acid levels in our stomach start to decline as well as we age. And this basically means that we can end up finding it harder to digest our food properly. And when you get, so the hydrochloric acid is really important for starting some of the processes of breaking down our food. And it means that if food is sort of getting into our digestive tract further down and it's not properly digested. And also if our motility is slowing down, things is kind of hanging around for longer, it can mean that things start to ferment a bit more, and we suffer more with sort of IBS and those sorts of symptoms.
Interesting.
Yeah, so that's quite interesting. And I think also it is a time of our life, like 40s, I think, and 50s has become quite a stressful time for women in particular, talking about the perimenopause. And, if you are quite stressed, if you've got a lot going on, we tend to also eat a bit more on the go, or we sort of skip meals, or we're in a bit of a fight or flight state. And that has an impact also on our digestive system. So when you're in a fight or flight state, you're not able to rest and digest. So our digestion kind of switches off a bit when we're very stressed. So it also means that we have difficulty digesting food. So it's just, sort of being a bit more aware. And actually it's something I work again a lot with clients on, is actually being more aware of how they eat and preparing to eat. And, are they in the right state? Is their body in the right state to digest their food properly? Because it can have quite a big impact on symptoms, gut symptoms, etc.
It is a difficult time, isn't it, of course, because women in their 40s and 50s tend to be that sort of sandwich generation where they have children, leaving home or still at school, and of course their parents requiring perhaps more input. So it's all a very focused time of great stress, isn't it, and anxieties, which exacerbates the problem. And the other thing that interests me as well is that, as you mentioned, the gut biome and acid levels and digestion. A lot of people with arthritic conditions are encouraged to take anti-inflammatories, ibuprofen, Nurofen, naproxen, all these types of anti-inflammatories, and paracetamol. And presumably they, of course, influence absorption, digestion, secretion of acid, because a lot of people who are on anti-inflammatories long term take a proton pump inhibitor drug like omeprazole. So how do you see these sorts of factors interacting with what you've talked about earlier? Is there anything we can do to mitigate the effects of those?
Yeah, the omeprazole is a tricky one, because it does, it sort of obviously is there for a reason, to to protect the lining of the stomach, and the sort of the harshness, I guess, of the drugs that are being taken. But it can actually have quite a knock-on effect. So it's a difficult one, because obviously, from my side, I can't really intervene on what's being taken as a medication.
Of course,
but it's being more aware of certainly some of the B12, for example, absorption can be affected if you are taking PPIs, proton pump inhibitors, because effectively, if you're sort of reducing the stomach acid, it can affect your digestive and absorption ability. And some people find it actually can cause things like reflux, because you're actually getting food sitting in the stomach for longer, and it's not breaking down properly, and it actually can create gas, and opening of the esophagus. So it's a tricky one. There's certain things that I can do to help, but a lot of it is about getting people to really slow down their eating. And really chew properly, so that they're just helping their own natural digestive processes to take place. And I think gut microbiome, certainly if you're taking a lot of pain medication, it's important to work quite a lot on that, because it can actually be can have a bit of a detrimental effect on the gut lining and the microbiome as well. So I think it's sort of working out how long someone is on them for, and if they are short term, it's making sure that they do actually come off them, because often people do end up staying on them for quite a long time. So working a little bit, obviously making sure that they're discussing it with their doctor, but how they can come off things like that. There are some quite nice nutrients that we use, which are sort of soothing, etc. But a lot of it is about really getting people to focus on that. They call it the cephalic stage of digestion. So it's even preparing food, and enabling the body to produce the right digestive enzymes and giving it time, and then the chewing. So I think that's the first thing I would address with clients.
Interesting, because the digestive process obviously starts with anticipation of eating, doesn't
Yes.
it? Because that,
Yeah.
we think about food, it gets the gut going, start to
Yeah.
secrete the enzymes. And
Yes.
of course, as you say, chewing your food properly, that's the mechanical process of breaking the food down so it becomes easy to digest. So
Yeah.
lots of really interesting topics there. And
Yeah.
just going back to the sort of surgical patients, I know it's something you may not have dealt with a lot, but a lot of patients who come to surgery, they will have had months of really being quite unwell with their arthritis, poor
Yeah.
sleep, perhaps taking opioids, constipated, poor nutrition, not sleeping well. And they have lost quite a bit of lean body mass because of the mechanical effects of their stiff, painful hip, and
Yeah.
have relative osteopenia, thinning of the bones. So trying to optimize those people before surgery has benefits, because we know they do better if they come into surgery as fit and strong as they can be. So
Yeah.
what principles might you sort of guide you into to helping those patients preoperatively so they can be optimized?
Yeah, I think again, the trying to adapt an anti-inflammatory diet pre-surgery would be really helpful. That I think, just to sort of make sure that they're just try and help their system to be in a less inflamed state to start with, will help post-surgery recovery. And I would definitely work on supporting their guts quite a bit as well, because I think, it's a really helpful thing to do. Just to make sure that the immune system is really primed to work well. Weight, I guess, might be trickier, because if they're not mobile, quite difficult. And like
it is a big factor, that.
Taking a lot of medication, etc. So that again, I think helping someone on an anti-inflammatory protocol would be beneficial, and hopefully weight as well would help a bit with their weight. But I think that might be harder, depending on how difficult they find movement. One thing that I think that would be good, and I tend to always check this with clients rather than just supplement, vitamin D levels. So again, if they've not been particularly active, they may not have been outside as much. And really, again, vitamin D levels can drop and are really important for regulating inflammation. So I would definitely put someone on a supplement if their levels were looking low pre-surgery. I think that's really important. I potentially do some supplementation with things like omega-3s, but you need to be careful pre-op because there is also a bit of a risk, isn't there, with blood thinners and blood thinning,
exactly.
too much.
And a lot of patients, particularly the older patient cohort, tend to be, or some of them will be on things like rivaroxaban and aspirin and all these antiplatelets and anticoagulants, because they may well have cardiac disease as well. So some complex interactions
Definitely,
there. But the common denominator seems to be that reducing inflammation preoperatively is generally the best thing people can do, isn't it, really?
I think so. Yeah, I think so. And because is having an anti-inflammatory diet, it ticks so many of the boxes as well. It's not just inflammation, it's everything that comes off the back of that. So it is a really good place to start, I think, for a lot of people. And like you say, I think with supplements, you do need to be I think people need to be quite aware actually of the drug nutrient interactions. So it's really important not just to take sort of supplements randomly, but just and obviously to let their doctor know as well, or their surgeon know if they are taking anything, because there can be interactions there.
Yes, I mean, I always ask my patients if they're on anything other than prescription medicines, and a lot of them take turmeric and things like this, and you do notice sometimes that people do bleed more, and of course that increases the risk of complications, wound healing problems. So we have a strong vested interest in knowing about these things.
Definitely, yeah.
Fantastic. So how would people get in touch with you then? What's the best way of them to contact you if they wanted advice before surgery and after surgery?
I mean, they can, probably the easiest is to go through my website. So that's sophielettnutrition.com, or they can email me, which is Sophie, so SOPHIE at Sophie Lett, and that's LETT, nutrition.com.
Fantastic. I'll put a link to those in the description and underneath the movie. But
brilliant.
That's been really helpful. I'm sure my patients will really appreciate that general advice, Sophie. And if they want more specific, personalised advice, I'm sure a lot of them will want to get in touch with you, because it is something we don't talk about very much in surgery. You know, traditionally, most orthopedic surgeons in the past have been middle-aged men. And we just do surgery. We don't think, well, traditionally haven't thought too much about the sort of more holistic aspects of the patients we treat. But it's changing. Things have evolved. We know much more about how patient factors, the host factors, are so important in shaping the outcome of surgery. And it's really important for us to know much more about the patients we're dealing with, so that we can give them appropriate advice and make sure they're in the best possible state before they come to surgery, because we know they do better.
Yeah, definitely. And I've definitely worked with some clients who've, you know, had surgery more because they've like broken or fractured an ankle or something, you know, something, they've had a fall, but where I have been working with them before that, and how quickly they recover actually is quite interesting. You know, people that have really sort of worked hard on getting their diet right and eating well and anti-inflammatory approach, and it does seem to make quite a big difference with recovery.
Fantastic. Well, it's great to talk to you, Sophie. Thank you so much for your time.
Well, I hope you found that interesting. I'm fascinated by the holistic aspects of what I do in surgery, not just the operation itself. My goal is to help you achieve the best outcome possible. If you'd like to know more about this, then please get in touch. If you'd like to contact Sophie, I've left her details below. If you've got any questions or comments, please leave them below. Thanks again for watching.